Hi everyone, this is Dr. Heather Austin Roblard, and this lecture video is going to go over different screening instruments for substance use disorders, specifically that will help you with your substance abuse evaluation. In this lecture video, we are going to go over a couple different components from the ICRC licensing exam. For example, we will be focusing on Domain 1, primarily the screening portion of Domain 1. We will also discuss criteria for evaluation of substance use disorders as it relates and pertains to screening tools. We will discuss administration and scoring procedures for substance use disorder instruments, as well as screening from the Brief Intervention and Referral Treatment, or the SBIRT, and appropriate screening and assessment tools that you might need to use in the future. First, let's review again what screening is. According to the ICRC organization, it is a process by which a client is determined appropriate or eligible for admission to a treatment program. These brief procedures are to determine A, if a presence of a problem is existing, B, if there is substantial evidence or reason for concern, and C, the identification for the need of further evaluation. So the screening tools are typically quick and dirty, and they usually pertain to A, the presence of a problem, or C, identifying the need for further evaluation. Before we talk about some of the specific screening tools, I want to go over some concepts and definitions that are important when it comes to screening. When we're screening somebody to identify whether they have a possible potential problem or if they need further information, we need to understand that we're looking for a true positive score and a true negative score. So what are these? A true positive, for example, if we're looking at pregnancy, if you take a pregnancy test and you are pregnant and it says you're pregnant, that would be a true positive. If you take a pregnancy test and it says you are pregnant but you're not, that would be a false positive. If you take a pregnancy test and it says that you are not pregnant and you truly are not pregnant, then that would mean it's a true negative. However, if you take a pregnancy test and you are pregnant, but the test tells you that you aren't pregnant, that would be a false negative. And when we're looking at screening tools, we also are looking for accuracy, which is the ability to differentiate between those who are sick and those who are healthy, as well as sensitivity, the ability to correctly identify individuals with a disease, and specificity, which is the correct identification of those without the disease. So we want a tool that has high accuracy, high sensitivity, and high specificity, so that way we're identifying those true positives and true negatives. The way that we do this is through cutoff scores. These are the scores where we say a patient is likely to have the disease, so a substance use disorder. The problem with cutoff scores is where to put them. If you take a look at the graph, you can see that there are two lines, criterion 1 cutoff and criterion 2 cutoff. If we decide to go with criterion 2 cutoff, which is the dotted line, what we're risking is that we may get more people who do have a substance use disorder, but we're also increasing the possibility of false positives where they're coming up on the substance use test saying they might have a substance use disorder, but they actually don't. If we go with a more stringent cutoff score, or what we see in criterion 1, you can see that yes, we're going to get less false negatives, but we're also going to get less people that actually identify with a substance use disorder. So we're kind of missing the wider net there. Now, you may be wondering what's the difference between a screening tool and an assessment or diagnostic tool. Well, these are the additional characteristics that kind of separate the two. A screening usually uses extremely sensitive cutoffs in order to identify those positive screens. However, this ends up resulting in a few more false positives, or people who the test is saying they have a substance use disorder when they actually don't. The screening tools are typically very low cost and non-invasive, usually self-reported or quick and dirty. This determines the level of risk for need of a diagnostic measure. So the point of the screening tool is to give us an idea of whether they need a more accurate assessment and diagnostic tool. It can be administered to those who fall into a high risk individuals that may have no symptoms of a substance use disorder. Assessment tools or diagnostic tools typically cost more because it's more important for accuracy to be required. And they do usually yield more definitive results where they can really tell us whether somebody has a diagnosis and what that diagnosis or severity might be. They have precisely defined cutoff scores in order to make sure we're identifying those positive results. And they can be administered to individuals who are showing symptoms of a substance use disorder, which you might have identified in a screening tool. So the question we've been trying to answer in this lecture video is, what is the use of a screening tool and where would we use a screening tool? Well, if we go back to Miller et al., a screening tool is usually going to be in the beginning to kind of identify A and C, right? Is there a potential problem? And do we need to, as discussed earlier, some screening tools can be used in the midst of an intervention. And for example, they can be used in conjunction with motivation interviewing or other brief interventionists. We're going to talk about two in this lecture video. The first one is SBIRT, which is screening, brief intervention, and referral to treatment. The second one we will briefly discuss is called BASICS. It is the brief alcohol screening and intervention for college students. These are essentially screening and motivational interviewing techniques. The intervention is typically beyond the scope of this specific class, but you can go train on it if you want more information. But we will see how the screening and tools are utilized. There is a lecture video, recommended video from YouTube, as well as a required video from YouTube showing you some of the components of SBIRT in a role-playing activity. With SBIRT, it is an evidence-based approach to identifying high-risk patients, reduce and prevent health-related consequences of risky use, and using a brief and tailored feedback to give advice and motivate them towards treatment. It is reimbursable and reduces overall healthcare costs. If you take a look at this drinker's pyramid, what you will identify is that 40%, majority of the population, is actually abstainers from drinking alcohol, and then 35% are low-risk drinkers. So on the audit assessment tool or screening tool, what we'll see is they might score between 1 and 7. Those who are high-risk drinkers might score 8 to 19 on the audit score. And those with a probable alcohol dependence would be scoring on the 20 or higher on the audit score, which is about 5% of the population. So what we're seeing is that means that 1 in 4 are probably high risk or dependent drinkers. The BASICS is a harm reduction approach for intervening with college students, typically those ages of 18 to 24. It is an empathetic and non-confrontational intervention aimed at reducing alcohol consumption and its negative effects. It also has a goal of promoting healthier choices and providing information and coping skills. And it tends to target those false or myth beliefs about alcohol. As you can see in the graph to the right, the changes in alcohol use related to their negative consequences, as experienced by college students, some that were receiving the BASICS intervention, as well as comparison groups. So as we can see with the gray diamond line, these were individuals who didn't really have alcohol use related negative consequences, and they didn't participate in the BASICS intervention. As you can see, their negative results kind of stayed the same throughout the years. Then if we look at the blue triangle, those were individuals who did have alcohol use negative results or consequences and participated in the BASICS intervention. And then we have the high risk comparison group with the blue square, who they had this, they started out with the same alcohol use related negative consequences, but they did not participate in the BASICS intervention. We do see that over the years, they both reduced in their negative consequences. However, those who participated in the BASICS intervention actually reduced quicker and far more. So what kinds of screening measures can you use? Well, we just discussed two of them, the SBIRT and the BASICS type intervention, but there are actually tons of them. So we're going to cover the most used ones and those that have been most rigorously evaluated. You will, in your What to Read in this module, have access to many of those screening tools. So if you want to check them out and give them a more thorough look, you can do that. First, we're going to go over the cage. It is one of the most commonly used ones because it's very short. There are just 4 questions and they're yes or no. The normal cutoff is 2, but there have been talks in recommendations to lower it to 1 in order to catch a wider net of individuals that might have potential alcohol use. It can be used as self-report or in an interview style. However, it has been criticized for lacking sensitivity in younger adults and college students. The tweak assessment is also known for tolerance, worried, eye-opener, amnesia, and cut down. It was originally developed for pregnant women, and as you can see, there's only 4 questions or 5 questions as well that are yes or no. You can earn up to 7 points on this. However, anything greater than 2 points would represent those who are at-risk drinkers. This one may look familiar from previous lecture slides, but it's the DAST-10, which is the drug abuse screening test. The DAST-10 has been reduced from the original 20 to 28 item scale, and it's specific for drug use. It usually takes about 5 minutes to administer, and it does have a quick index for drug abuse problems. And it is inherent with the substance use disorder from the DSM-5 in that it looks over the last 12 months. The MAST, or the Michigan Alcohol Screening Test, is an originally 25 items with 98% accuracy in predicting potential alcohol abuse. For this one, if you score above 5, then that would represent potential alcohol abuse. There are shorter versions, which are called the SMAST, which is 10 items or 13 item version. And there is one version for geriatric sample called the MAST-G. The CRAFT, which stands for Car, Relax, Alone, Forget, Friends, Trouble, is a short screener specifically designed for adolescents. It is designed to be kind of a cage aid for adolescents. It covers both alcohol and other drugs, but focuses more on problems related to consumption. There are some newer versions called the Craft Nicotine or Craft N 2.1, which focuses on nicotine products. And this can be used in both an interview style or self-report. And as you see in this graph, it can predict the percentage of substance use disorders from the DSM pretty heavily after somebody scores over a 4. The WHO Assist stands for Alcohol Smoking Substance Involvement Screening Test. It is a little bit longer than some of the previous screening tools and requires a little bit more practice, usually through interview styles. However, it does cover a wide range of psychoactive substances compared to the other screening tools that primarily just focus on alcohol or drugs in general. It is also more cross-culturally valid, meaning you can use it across cultures. It has some result sheets that are easily incorporated into brief feedback and intervention. These feedback sheets are located in your What to Read in this module. This is another familiar one, the audit, which is the Alcohol Use Disorder Identification Test. It is a 10-item odd screener developed by WHO, which focused on 2 factors: consumption, audit C, which are items 1 through 3, and harmful use, which are items 4 through 10. If you're using the audit C score, then a 3 for women and a 4 for men, then you would go to the full audit. It also focuses on brief intervention, as you can see in table 3. So anybody scoring above 13 for a woman and 15 for a man would kind of give you an insight onto what severity level they have on their alcohol use disorder. Along with the audit, there have been some other versions of screeners. One includes the QDIT, which is focused on cannabis use disorder identification, the DUDIT, which is a drug use disorder identification test, and these may not be as widely used and or validated as often as the audit, but you can use them for specific clients who may have these disorders. So in summary, it's important to recognize that screeners are to screen. They're not meant for definitive diagnostic measures, but they are a good indicator that further assessment might be needed. Screeners are recently being heavily used for brief interventions, So you may want to be mindful about what specific screeners you're using for specific drugs or specific populations or normative samples.